A medical personnel whose identity will remain anonymous throughout this story is alleging that nurses at the maternity unit of the Gphc Public Hospital are facing several challenges as a result of proper systems not being put in place during the pandemic. The woman explained that for the first time, mothers seeking prenatal, labor room, and postnatal care were forced to be in the same ward due to prevailing issues with limited space. According to her, the other wards at the maternity unit are currently being utilized to house pregnant COVID-19 patients.
And it was very confusing. And then there's a new area down on the tarmac where we have admission and triage. And it was kind of confusing. The thing about it, they only have a toilet there for the patients alone, no toilet access for the nurses. We have to be in an area to the next, which is quite disappointing.
She added that there's also insufficient gowns for the nurses to wear to adequately protect themselves when interacting with COVID-19 patients.
We don't have adequate gowns for each nurse, so we were forced to use our cloth apron and gown, which is not the right thing for this time around.
She further lamented that suspected and confirmed COVID-19 cases are now being warded together back of the prenatal area since the previously designated space to house COVID-19 patients are currently filled to capacity. She's adamant that the patients need to be relocated to another institution so as to prevent the possibilities of the virus spreading.
We have them to their back, but in the said ward, they're not further off. We should send these patients up to Lilliandale or home where they can do self-quarantine.
When contacted, Shalana Providence, head of strategic planning and communications at the Gphc Public Hospital, informed that as a priority, positive maternity patients are transferred to the infectious disease hospital. Providence could not confirm or deny the claims made by the medical personnel, but positively stated that suspected COVID-19 maternal patients are placed in a transition ward in another section of the institution as they await their test results. She noted, too, that additional infrastructure is being built at the unit to adequately accommodate more patients as the need arises. $150 million was recently tabled in the 2020 budget to aid frontline workers in the fight to contain COVID-19. Tamika Rodney reporting for the HGP Nightly News.